Hi, everyone. We're here today with Catherine Schvitz and also with Gage Hofbrick. And we're going to be discussing the $12 million in cafeteria losses. So why should Canadians care? Well, that's actually 1,700 MRI scan for patients. And it's also an interesting conversation to tackle during COVID, where hospitals and especially the healthcare should be looking at issues of how to save money and also to improve the system. So, Catherine, can you start off and kind of explain to us, like, why should we care? What does this mean for Canadians across the country?
Exactly. So it's a very good question because in retrospect, when you look at it, $12 million does not seem like much when you compare it with how much is actually spent on healthcare in Canada. So it doesn't seem like important losses. But as you mentioned, during COVID, it was a very, very hard hit. So it's really the right time to start looking at where can we save, where can we optimize operations, and where these government inefficiencies are really starting to be very costly. Because exactly, so we already had all these wait time problems, all these delays in procedures. And like you mentioned, all this backlog in surgeries is really starting to weigh heavy on Canadians' health, well-being, and just the use of their the freedom of their time and energy that they can that they have to go through with during this very, very hard time.
Absolutely. Engage, let's hear from you. So, what actually led to this research? Why did you guys start developing this type of conversation?
Well, in the past, in 2012, the media reported on some hospitals in Windsor and St. John's that had lost over $500,000 from running Tim Hortons in their hospitals. And that was a pretty big story when it broke. And obviously, $500,000 is a lot of money, especially to lose running something like a Tim Hortons in Canada, which you expect wouldn't be possible. So basically, starting from that point, we talked about what would happen if we did it to a wider range, because when that research was done, it wasn't done all across Canada. So we figured if they were losing some money in these other places, then potentially they could be losing money all across Canada. And that kind of led us to building this big comprehensive report.
Wow, that's fantastic. And is there anything specifically that you really stood out to you in your research?
I think the most interesting part about the research is there wasn't a single jurisdiction that we looked at that gave us complete data that didn't have a loss. So
Mm,
all the way from Vancouver Island to all the data, the only data we could get in New Brunswick, they all had some sort of losses. And I think that was really interesting that no government and no hospital is susceptible from this. So I think that's a good takeaway.
mhm. And Catherine, what did you discover about government-run Tim Hortons in your area?
Exactly. So the way it worked is that Gage took on more of like the western part of Canada, whereas I looked at the eastern part of Canada. And a problem that I saw across all of eastern Canada, except for New Brunswick, is severely incomplete or inadequate data. So accounting practices in Eastern Canada and Atlantic Canada, or like specifically, are such that they don't really take into account like food services as a business. So losses are considered normal. So any expenditure is considered normal. And the way that that works with a lot of the health regions is that food for patients is considered to be the same as the food that is sold to the public or to the employees. And then when you have to look at this data, it's impossible to break down, and it's impossible to evaluate, well, what are the actual losses of the operations you're running.
Right. And how
Yeah.
do you think governments can improve on this in terms of in your area? So you were primarily focused on Quebec and Atlantic Canada, and what can local provinces do?
Um, so definitely, definitely looking back on accounting practices because, well, like I said, it's very difficult to see where your operations are losing money or are in a way harming like very indirectly harming your patients because it's money that is being taken away from um, actually treatments, going into food service losses. And I think the very first thing is that the foundation is accounting practices. So you really need to go back and look at, okay, well, um, what are the actual losses and what are the ways that we can at least, break even? Is there a way to contract out? Is there a way to rent out the space? Um, yeah, I would definitely start with that because if you don't start with accounting practices, you don't really know where the problem is.
Mhm.
Yeah.
Totally. And that makes a lot of sense, especially from a patient care perspective as well. Now, Gage, did you find the same type of problems that were happening from, because you had BC all the way to Ontario and you covered that jurisdiction? Is there anything specifically that stood out for you as well that governments can do in those areas of Canada?
So, interestingly enough, I didn't have the same level of the accounting issues that Catherine experienced in Eastern Canada, but there was some of that where some of the health regions, for whatever reason, were unable to split up some of the expenses we were looking at. So that made that information a little hard to deal with. But overall, the most important thing that I saw is instead of some hospitals losing money on their cafeterias or like their food service places, a lot of them rented them out. Not necessarily even as a profit making measure, but just something to make sure that it would at least break even or not lose the hospital any money. So, for example, there was a couple hospitals in Ontario that ran Tim Hortons, but instead of losing money like they did in the past, of those ones we mentioned from 2012, they actually were able to gain thousands of dollars of rent every year for no work for the hospital. So I think that is another interesting policy option to go forward when you look at changing up these cafeteria losses.
Right. And that totally makes sense so that if they do save in certain areas, they can apply it to other operational costs. Is that kind of what you're saying?
Yeah, basically, and it's important to note that we're not trying to say that all hospitals should be trying to make millions of dollars off of their
No, no.
Tim Hortons.
Mhm.
But if you're able to turn a loss into a break even or even to a gain, then as you said, that can go to paying for more MRI scans or anything else that a patient might need.
Totally. And I think that's a really important takeaway is, the whole focus, it sounds like from your guys' perspective, is really about the research for what is patient care and how can we improve the system and where can we look at operationally what needs to be done in terms of accounting perspective. And
Exactly. Like the only thing I wanted to add to what Gage was saying is absolutely like we're not expecting, for governments to suddenly become efficient businesses. It's more the question of, well, is there anything that they do that they can leave to efficient businesses and focus on what they should be doing, which is healthcare. So it's not about suddenly making millions of dollars, but perhaps not having losses of millions of dollars.
totally. And do you guys have any other further comments to add? Any other policies that you've been kind of digging into that would really be beneficial for cross provincial jurisdictions like this?
Well, Gage, I think it would be interesting if we looked at the Tim Hortons specifically. So if you could maybe mention I think the one in Windsor that is losing less money than it did before. And I'll just start with mine, which is their so compared to the research on this that had been done before, there's a lot less. So Tim Hortons are not losing as much money because slowly it does seem that there could be a trend of contracting out or finding third parties to take care of restaurants like these. So across Canada, we found only 2 Tim Hortons that were losing money. One of them was in New Brunswick, which still had like pretty serious losses for its importance for the years that we examined. So the first one was like 170,000 in losses, yeah, in dollars in losses, and the other one was $110,000 in losses. And if and that's a Tim Hortons, right? Like if that Tim Hortons was on the corner of your street, like it wouldn't exist the next year if it had like losses this severe. So in a way, it's like at least starting with Tim Hortons are not cafeterias. So with machines like this that are technically very possibly profit making, how can we at least start with not losing money with machines like Tim Hortons, and then start looking at perhaps cafeterias or bigger services, food services like that.
Totally.
Right, yeah. So on the slightly more positive note in relation to that, in the past was found that the Windsor Hospital was losing large sums of money. We lost $265,000 in 2012. But based on our research, it still is losing money, so all's not perfect, but it's a much less significant sum at about $27,000 in 2018-19. So that they're still losing money, so it's not great, but it is an improvement on what was reported on in 2012.
And is there something specifically that they did that really gained in them not losing money? Is there a specific protocol that they followed, or what was it?
We don't have data on that for Windsor, but one of the hospitals that was losing money in Newfoundland in St. John's, as Catherine can maybe explain a little more, is now contracting out their Tim Hortons to a third party. So that
Exactly.
could improve that situation.
Sorry. Yeah, so like Gage mentioned, so yeah, like one of the starting, elements of the story was the Tim Hortons many years ago that was losing ridiculous amounts of money in Newfoundland. And since then, I think it was in Eastern Health, it was found out that that same Tim Hortons, or at least in that same health region, was now contracted out to Compass Group Canada. And the hospitals don't have, you know, data like revenue or expenditure data for that Tim Hortons. And like quite logically, probably because it's now operated by a third party. So if anything, it would be assumed that they're not losing money on that Tim Hortons anymore, but perhaps even gaining from it.
Totally. Well, thank you so much, guys, for coming on and discussing this issue. I found it really interesting. I think at the end of the day, what we really always strive to do at Second Street here is to really speak about patient care stories and how they can be improved and how the system can be improved. And please follow us at secondstreet.org.